after such a great speech. Depression, actually, the topic was a depressing topic, but he made such a lively and really, after that speech, I think we'll have to bear my speech also, which is completely different. It's the opposite of uh, the, the advanced directive. In this, it is also relevant. The advanced directive here also is important because uh, we have how many people are below 50 years here? I don't think many are there. Very few are there. So for them, this topic may be of some use. This is a new topic, inflammaging, inflammation and aging. And this is a very important topic and uh, very relevant, and it will change our treatment process completely. Before I start the topic, one or two more points, what are thoughts I want to tell. One is when a patient comes to me and he talks all depression, now I have age now, this is going to happen to me. Anyway, because of age, now I'm getting these symptoms. We want to change that thought process. We have to inculcate longevity mentality in all the patients and in ourselves also. We must always think that we live for 100 years. Why not? We live for 100 years and we live healthily. First point, that is one thing. Number two, our treatment strategy should be, there should be some strategy for treatment. Just after some disease comes, and we treat them, diabetes, if heart attack occurs, we do bypass and coronary angiography. That's all retrospective. We do HbA1c, and then see after 3 months of diabetes, then we are checking his sugar levels. All our treatment process is disease based. Only we treat the disease only, but we forget that the same vascular problem which is occurring in the coronary artery is all through our body, and our other organs are also failing. So that should be kept in mind, and we should have a forward planning for everything. Like my previous speaker told, everything has a forward planning and strategy. In cricket also, supposing Tendulkar plays, he so much of research goes on in cricket game also. The bowler, how he will bowl and how the batsman should play. He'll be bowling only off breaks only. So we have to play like that. So similarly, our approach to health also should be like that. We should know that we are having family history of coronary artery disease or hypertriglyceridemia. We have to plan it like that only. We have to take care of those things in beforehand. That's my crux of this. And this is a new topic which is now, it has started from 2000 onwards, and now it is gaining very much importance. And I feel our approach to the treatment will change with this. So I'll be talking about this topic into, see, we must know about what is the physiology of aging. Maybe it is boring for you, but I'll have to scrape through all those things. And inflammation, what is acute and chronic inflammation? What are the causes of chronic inflammation which goes on in our body? And then I'll have to talk about some environment of the senescent cells which are there. And then clinical relevance and the future directions, I'll be covering it up. So as everyone has told, our life expectancy is increasing. Now it is 76 years in females and 70 years in males, in males, and it is called the silver tsunami. So we are going to get more and more elderly people, and our importance as geriatricians is going to increase. And I think we are lagging very much behind, though we have talked so much of suffering is there in villages, and maybe we are touching only about 5 to 10% of the people. Lot of things have to be done by the government, mainly by the sanitary people and other things. Unnecessarily, people are suffering just because of the bad sanitary conditions of the bad government and the politicians. So while life expectancy continues to rise, health span is not keeping pace because current disease treatment often decreases mortality without preventing or reversing the decline in overall health. Current treatments focus only on individual disease and do not address the very core of their origin. Medical research has historically targeted diseases separately, and optimal functionality of single system requires overall organismal health. There is a bidirectional, this is important. On this, I'm going to talk more about. So, there is a bidirectional cyclical relationship between chronic inflammation and development of all age related diseases. As early as 1863, Rudolf Virchow had noted that there is leukocyte infiltrates in the tumor tissue. Actually, aging, the physiology of aging and the physiology of cancer are almost same. And we think aging is a protective phenomenon of cancer. If you don't die, most likely that all are going to get cancer. The inflammaging concept was introduced in 2000 by Professor Francis, and this was revolutionary conceptualization of immune changes in response to lifelong stress. So our immunity not only decreases, it is misdirected also. Autoimmune diseases we get. All these are all because of the chronic inflammation in the body. It's a slightly complicated and means the cellular theory and other things. If I go on talking to it, may be boring to you. But I would like to summarize the physiology of aging into this. Even the inanimate animals, inanimate things age. Why do they age? Because of their external stresses, means UV rays or heat, cold, moisture, whatever you say, they are aging. Human beings also have the same risk factors, but human beings have another risk factor here. Our body, in the body, when the cell duplicates, it becomes old, and the cell debris and other things are not excreted fully. They become also active, and inflammation is continued. So we are doubly means there are two double actions on us in aging. So the thing is, the cycle of growth and replication, the regulation of this cell cycle is there. Mitosis occurs, but after some time, the cell doesn't start stops duplicating itself. So it is only the replication is important for growth and development in embryos and in the young. But when there is need to replace the damage, and also when there is need to replace the damaged cells like in endothelium and in skin and other conditions, we require this one. So the birth and death of cells is because of apoptosis and because of autophagy. There are 4 theories of aging. We have been told these are all fundamentals. Maybe you all must be knowing. The cellular senescence, which occurs because of the telomere shortening or DNA damage. And the other theories of aging are the autoimmune theory, the glycation theory, and the oxidative damage theory. You must be knowing antioxidants we give, the glycation theory. Glucose is important mediator of aging, and glycation, in which simple sugars bind to molecules such as proteins and lipids, has a profound cumulative effect during life. Such effects may be similar to elevated glucose levels, and means in diabetics we see shorter span of life because of this glucose only. So, in summary, so many, see, at the organ level, at the cellular level, at different levels, there is aging is going on. But in the intracellular levels, there will be loss of proteostasis, genomic instability, telomere attrition. All these are called the hallmarks of aging. Disabled macrophagy, dysregulated nutrient sensing, mitochondrial dysfunction, cellular senescence, stem cell exhaustion, altered intracellular communication, dysbiosis. Dysbiosis also is now is getting into a lot of importance nowadays. So we should understand inflammation is a protective phenomena. Acute inflammation, the skin is broken, and when the pathogen or virus or anything enters into the skin, the parasite, these molecular patterns we call parasite-associated molecular patterns. The names are so big, but just they are only the reactive things in the body. So the damage-associated molecular patterns. Then they stimulate the mast cells, and the mediators of inflammation like MOI are released. And these MOI make the blood vessels translucent, and then macrophages come out, and they try to engulf the parasites and stop the acute inflammation. But when this continues, and if they are not able to completely control the inflammation, that goes into chronic inflammation. So chronic inflammation is potentially pathological process arising from perpetuity of this initial trigger and are the dysregulation of signaling pathways that are harmful to death. So inflammaging is a low-grade chronic inflammation of aging, during aging without overt infection. There may not be any infection, but chronic inflammation goes on because even the senescent cells produce certain inflammatory cytokines and other things. So, what are the mechanisms of chronic inflammation? When there is a persistent infection like mycobacterium tuberculosis or viruses like hepatitis B, fungi and parasites, when there is a dysregulated immune response like autoimmunity conditions like rheumatoid arthritis, lupus, and then when there is allergies also come under dysregulated immune response, prolonged exposure to irritants like silica, asbestos, industrial chemicals, smoking and air pollution, all these things can cause age-related diseases like pneumoconiosis. And then there is obesity and metabolic dysregulation. Adipose tissue, especially the visceral fat, secretes pro-inflammatory cytokines, TNF alpha and interleukin 6, contributing to conditions like type 2 diabetes, atherosclerosis, and non-alcoholic fatty liver disease. Persistent activation of macrophages. Same thing, if acute inflammation continues into chronic inflammation, then it is dominated by macrophages and release of pro-inflammatory cytokines and reactive oxygen species. Then angiogenesis and fibrosis. These chronic inflammation gives rise to promotes the formation of new blood vessels and activation of fibroblasts that is seen in liver cirrhosis and pulmonary fibrosis. Then oxidative stress like reactive oxygen species and reactive nitrogen species produced during inflammation cause tissue damage and DNA mutations. So role of cytokines and chemokines. These cytokines, TNF alpha and IL-6 are important, interferon gamma. The imbalance between the pro and anti-inflammatory cytokines perpetuate the inflammation. So these are normal and bronchitis changes and atherosclerosis of the aorta. Next thing we must understand is the microenvironment in between the senescent cells. It's a complicated thing, but I have tried myself to simplify them. So this is a complex network of signaling pathways and molecular reactions that occur in senescent cells. It involves secretion of pro-inflammatory cytokines, chemokines, growth factors, proteases, which affect tissue and microenvironment and play a critical role in aging, cancer, and tissue remodeling. What are the main same thing? Cytokines, chemokines, growth factors, like growth factors influence in tissue repair, fibrosis, and angiogenesis. And proteases, these are very important matrix, metalloproteinases, degrade the extracellular matrix, and feldstate tissue remodeling and tumor invasion. These are important in Alzheimer's disease and other diseases where the proteins are degraded. And then there are biological outcomes are inflammation, tissue remodeling, and tumor progression. It is something like this. The senescence associated SASP we call is something like this. So it can give rise to protective, it may be beneficial, it may be detrimental. Protective is in embryonic development, it will stop at the time when it has to stop, and tissue regeneration, wound healing, and tumor suppression is helpful. But it is a cause for tissue regeneration, chronic inflammation, and tumor promotion also. So this is the main slide, which is the car slide, which I have told you. So these SASP factors can be secreted by the senescent cells on one side and by external stresses like viruses, fungi, and other things, bacteria, and all injuries, UV light, all other things. Both these things cause chronic inflammation, and chronic inflammation leads to all age-related diseases. This is the main slide summarizing all the points which I have told you. So on one side, lifestyle, infections, diet, exposure to all pollutants can cause chronic inflammation, and this genomic instability, telomere attrition, all these hallmarks of aging can cause changes in the mechanisms of chronic inflammation, and both these things can lead to aging and age-related diseases. Clinical, very important. When we examine an old person, Just he comes with pruritus, I'm having itching. We should give importance to that also. Some chronic inflammation is going on inside. If there is a balance problem, if there are achy joints, if there are acne issues, if there is craving also increases. Supposing I want to eat sir, I have had 2, 3 bars of chocolate yesterday. I was just feeling like eating. That is also not normal. Something is going wrong there. Then swollen lymph nodes, anxiety, depression, foggy brain. I'm having a foggy brain, they say. Sometimes I'm not able to concentrate at all, sir. I'm just feeling very fatigued. These things are the harbingers, they are the pointers that something is going wrong inside. So, major causes of inflammation and their contributions are infections, autoimmune disorders, tissue injury, chronic irritants, obesity. Obesity also, the visceral fat, very important. It cannot be left alone like that. And allergies. So, all these neurodegenerative diseases, periodontitis, metabolic syndrome, age-related frailty, cancer, cardiovascular disease, ocular disease, autoimmune diseases, pulmonary diseases like silicosis and other things, all have a chronic inflammation background. And all these diseases also cause chronic inflammation. There is a bidirectional relationship between chronic inflammation and all these diseases. Similarly, autoimmune attacks, tissues which are affected by autoimmune attack, like Hashimoto's disease, thyroiditis, Graves' disease, multiple sclerosis, autism, Guillain-Barré syndrome, and rheumatoid arthritis, ankylosing spondylitis, polymyalgia rheumatica, fibromyalgia, muscular dystrophy, eczema, psoriasis, scleroderma, asthma, vascular granulomatosis, peripheral neuropathy, diabetic neuropathy, celiac disease, Crohn's disease, ulcerative colitis, all these things have some chronic inflammation as a basis, and there is a dysregulation of immunity. Main thing in old age is our immune system gets dysregulated. Not only it is decreased, it is dysregulated also. So what are the things which can prevent chronic inflammation? This is repetition. Only thing, the consume whole grains, natural foods, plenty of vegetables and fruits, which are called anti-inflammatory foods, and avoid sugar, simple sugars, refined carbohydrates, high glycemic foods, trans fats and hydrogenated oils, which are the inflammatory, pro-inflammatory foods, and exercise regularly, maintain optimum weight, very important. Sleep is most important. One chapter is there for sleep, means we have to sleep, strong sleep, 6 to 7 hours to regulate, to rejuvenate ourselves. We need a strong sleep in this old age. Stress less. I can tell you with my own example, if I am under stress because of some financial or any other issue or family issue or anything, I start memory, my dementia. I start losing the names of the people. Once I am in a good mood, I speak very nicely, I remember all the names. So stress is very important. In old age, we should be as far away from the stress as possible, number one. If you have grandchildren, always give 1 or 2 hours with play with the grandchildren. That is a very great remedy. And calorie restriction, most important. In the one thing which I want to convey will be calorie restriction. Keep your body fit. I am also not able to, I am trying to keep it. Statins are important as anti-inflammatory. All diabetics 50 years of age should be on diabetes. If you are not giving the statins to them, then you are not practicing correctly. Minimize intake of antibiotics and NSAIDs. And what are the tests nowadays we can do for chronic inflammation? We can do hypoalbuminemia is an indicator, C-reactive protein we do regularly, fibrinogen, human necrosis factors, and these things are also being done nowadays, but we don't do regularly. We do only CRP. When albumin less also, we think that there is something wrong going on. Then, future directions. This is important. After that great lecture by of AI, I think this is also less only. But biomarker discovery is now happening. Not only the biomarkers, which are in general biomarkers, the personalized profiles are also being made nowadays. Longevity and health span can be increased nowadays by mechanism linking inflammation, aging, and health span interventions. So if we know the basis of our aging, and if you are able to know the mechanisms of inflammation, then maybe we can do research in reducing the inflammation. Next, epigenetics and environmental factors, even the gene modification they are doing, and we are seeing that if they do it in the parents, children also means protected from certain diseases. And personalized precision medicine, uh, uh, artificial intelligence and machine learning, patient-centric approaches, and gut micro. This is also gaining importance of gut microbiome and inflammaging. But whether it is a byproduct of inflammaging or the gut microbiota are causing inflammation, and even the fecal transplantation they are saying they are all in the preliminary stages. Immune rejuvenation, there are therapies which are rejuvenating the aging immune system, interferon, other things, whatever we are using. Therapeutic strategies like senolytics, anti-inflammatory therapies, and lifestyle interventions. So senolytics are the drugs which are used for reducing senility. So summary is, while life expectancy continues to rise, health span is not keeping pace because current disease treatment often decreases mortality without preventing or reversing the decline in the overall health. And the rapid growth of elderly population makes it increasingly important to understand the aging process and promote lifestyle choices, maximize not only longevity but also quality of life during aging. Current treatment focuses more therapeutically on individual repetition, and inflammaging is say. So what I want to say is, if we are really proactive and if we are having planning from the strategical management of our own, then I think we can add at least 1 or 2 decades of healthy span, not of lifespan, healthy span we can add. That should be our aim. Another aim of all our geriatricians should be this not only longevity mentality, the society's ageism should be means it should be changed by we geriatricians only. Thank you very much.
Thank you, Dr. Mahesh, for the very elaborate discussion on this very important topic called inflammaging. This is something that is often ignored, especially when we talk about aging and the process of aging. I think from now on we'll have to take off the desserts from the menu of our conferences because sugar is supposed to produce.
Yeah, both sugar and salt. Salt also we should reduce, but sugar, I think after 50, nobody should eat sweets. Number one, that should be one thing we should decide.
But it's too tempting to avoid anyway. So the floor is open for maybe 1 or 2 questions or comments.
Important thing is ultra processed foods.
Yes.
That is our at domestic setup. Our fridge is full of items: marmalades, jams, pickles, sauce, and in the food, our fried items. So these are the issues termed as ultra processed foods. And within the anti-inflammatory foods that we can consume, I think some of the Indian spices. One is turmeric, and the second is ginger. So these are very good. They are of course used in our diet, but it has to be balanced. That anti-inflammatory, but if we give pro-inflammatory ultra-processed foods, the action perhaps gets neutralized. So this just general piece of information that to the extent possible, if we are in a position to restrict or even cut down on the foods, particularly in pediatric population, I think we'll be able to avoid much of the early diabetes that we are seeing. Thank you.
Thank you. This includes bakery items also, I think.
Just out of curiosity, some effect of metformin in longevity. Some, as mentioned, I know that metformin is used as in the pre-diabetic stage also, but has it some role in longevity?
Yes, sir. Yes, sir. Metformin has a role in longevity, but not completely proved. So we are not able to means even the SGLT2 inhibitors which are coming out nowadays, dapagliflozin, these things are good not only for the diabetes, they are used now for chronic heart failure and other things. So these are called the silver bullets. There are multiple effects. So metformin, really very good drug. Steroid used in very, means cautiously used steroid is very good. These are some of the drugs which are really good in our armamentarium, but if they should be used very cautiously.
I think we'll take the last constraint by time.
Okay. Sorry to take your time. Thank you so much for elaborating in great detail the process of aging. And I think it's very important that we should study and see how these processes actually affect us. But I really want to add a different tone. You know, if you look at the animal kingdom, once the lion has reproduced, it is the male dies off first, and the female is just alive to look after the child. After that, it dies. Now, the same should follow in the human. The human race, Homo sapiens, is the only one that is actually aging after reproduction and living for a longer time. So, why is that happening? We don't know. Once we've done the, it's a philosophical question I'm asking
Sir,
you.
yeah, madam, I
I
agree
just want
with
to
you.
complete that at the time of independence, we died at the age of 45, 46. That was the life expectancy in India. And after that, we are now in the 70s. What actually has changed? It's not that the medications, okay, antibiotics have saved certain people, but it's the drinking water and other things have really improved. We are not dying of typhoid and big diseases, immunizations, etc. But now the non-communicable diseases are taking their toll on us. So my idea is, let's not even try to prolong life by doing all those tests about inflammation and all. It's good for us to understand it. All we should do is healthy life. I think death is predetermined. What we should do is that word compression of misery. As healthy aging points were given by the WHO person Amrita, we should have only 1 year, 6 months, or 3 months of ill health before we die. But let us die healthy. Not a long life, whatever is predetermined for us.
Thank you so much, Dr.
Madam,
Mahesh.
that
I think we will
for-
close the session
yeah.
now. Thank you so much.
Okay.
Yeah.